So what kind of medications are there for chronic fatigue? Chronic fatigue is a condition that affects so many lives. It affects people in so many aspects of their life. It affects people in different aspects of their own situations and different kinds of careers and different age groups. When you're tired, you're tired. Your life doesn't do very well, does it? Right? And when I talk chronic fatigue today, we're going to talk not about the condition called chronic fatigue syndrome, but more about that state of chronic fatigue, chronically feeling tired, exhausted, not up to doing things that you really want to be doing. So today we're going to talk about what is the background on medications for chronic fatigue. Are there medications for chronic fatigue? And if so, what are the best approaches? So welcome back. I'm Dr. Rita Murillo-Scalzo, and welcome back to the channel where we help health and wellness practitioners to get to the root causes of their patients' and clients' health conditions, including chronic fatigue and hormone imbalance. And we help people with those same problems. And I'm excited today to talk about a topic that's very near and dear to my heart. So let's get started. Let's start with number one, first and foremost. People are looking for quick fixes, right? You might be like, okay, I have this condition. I go to the doctor and I say, what's the solution? And there's usually some sort of medication that gets prescribed. And so if you have a sore throat, there's a medication they'll give you for that. If you have a specific bacterial or viral infection, they have medications that they want to give you for that. The unfortunate thing is for fatigue, when you go in there saying, I'm just tired all the time, I just can't get through my day-to-day tasks, they don't really have a medication for that, unfortunately. A lot of doctors will say, okay, let's check your thyroid. And if your thyroid is off, in medical terms, maybe the TSH is a little high or the T4 is a little low, they may prescribe thyroid hormone and think that that's solving the problem of your fatigue, why you're tired all the time. Because quite frankly, of course, thyroid imbalance, low thyroid function can contribute to fatigue, right? They may say, well, let's check your iron. And if your iron is low, they may not give you a medication per se, but they'll give you iron supplementations or recommend iron supplementations. And in many cases, there are prescription iron supplements that they can prescribe. But other than those two things, I don't know of any medications that actually treat chronic fatigue. Why? Because chronic fatigue is something that can be affecting all the body systems. The underlying cause can actually be imbalances in any number of body systems. And so there's no one drug that can be treated. Let me give you an example. Alzheimer's disease. They've been looking for a cure for Alzheimer's disease for a long time. Researchers are experimenting to try to find a drug solution. But the truth of the matter is, there are no drug solutions, no single drug solutions for Alzheimer's. There may be things that can help with the symptoms, but because they don't really understand all the multifactorial causes, one drug is not going to do it. Really great reference book on Alzheimer's that talks about this situation, and I'm going to relate it to fatigue in a second, is Dale Bredesen's book, The End of Alzheimer's. And he talks about all the research and all the drugs and all the mechanisms that they're trying to fix. And what he's identified is 36 different causes. And unless you address all those causes or most of those causes, you're not going to have a cure, quote unquote, for Alzheimer's. Same thing with fatigue. We have to address all those underlying causes, or we're not going to help people to overcome their fatigue. We may get symptom relief. Some people say, just take caffeine. Caffeine's great, and it's going to boost you, and it's got all these antioxidants, or coffee, for example, green tea. And yeah, green tea can be super helpful to give you a little lift. But it's not the solution. It's not a drug approach to chronic fatigue. So what is the approach to chronic fatigue? Well, we've got to identify what's going on. I've created this thing I call the fatigue fixing framework. Not formula, not protocol, but framework. And the difference between a protocol and a framework is huge. The difference between a protocol, which says, oh, here's the disease, here are the things we do to fix it. Here's the condition, here are the things we do. And whether you're looking at it from a purely conventional medicine with drugs and procedures, or from a functional perspective and looking at nutrition, all of it comes down to the same thing. There's no one approach. There's no one cause and cure. And if you come up with a protocol, it says, oh, the protocol for chronic fatigue is to take the iron and supplement with thyroid and add these herbs. Great, but it doesn't address everybody's chronic fatigue because it doesn't address the unique underlying causes for each individual person. So I'm a big fan of personalized medicine, personalized healthcare, creating personalized approaches for each person. And so what I've developed is frameworks. I have a framework for autoimmune conditions. I have a framework for hormonal imbalances. I have a framework for chronic fatigue. I have a framework for digestive imbalances. But what does that mean? The framework consists of some evaluation procedures, some evaluation tests or questions to identify the cause, and then some protocols, sort of, some plans, some program components based on what you're finding, based on what the underlying cause is. So for example, you go to the doctor and you say, I'm exhausted all the time. How long has it been going on? Oh, it's been going on for years, right? We ask specific questions that are not typically asked in conventional medicine because we want to look at what are the real underlying causes. So we may ask about digestion, and we ask about blood sugar balance, and we ask about moods, we ask about emotional stressors, we ask about what's going on in your life. What kind of traumas have happened? Have you moved into a new home? Did you move into a place that is more humid or more moisture ridden, and maybe there's a mold issue? Did you have an experience of having had a specific viral infection or bacterial infection that, you know, now you have this fatigue after it? It could be related to that, right? Did you have, let's see, what's some other things we can ask? Did you have a trauma or an accident? I know people who will have been in a car accident or bang their head, and they have these bouts of fatigue afterwards. So we have to ask the right questions, right? What emotionally happened in your life? Did you have a divorce, a death of a loved one, a move to a new place? We ask all these questions. Then we want to look at some testing. What kind of testing might be appropriate? And the testing is, yeah, you can do some fancy functional medicine tests, like look at the gut and look at the GI effects test, or you can look at the hormones via saliva tests or Dutch testing. So there's tests you can do, organic acid tests, but there's so much in the routine blood tests that are missed, gems that are missed. So there's so many clues to fatigue. And in addition to just iron or ferritin, which most doctors do iron or ferritin, they don't do a full anemia panel. You need to do iron and ferritin, because if they're the same, it means one thing. If they're in different levels, one's high, one's low, it means a totally different thing. That can be the underlying cause of fatigue. There could be genetic factors related, right? You have a tendency towards not detoxifying certain chemicals, but you've been exposed. That's another question to ask about toxic exposures, because those mitochondria that live in every cell, they're very sensitive to toxins, and they will shut down the energy production if they perceive there's something more important that needs to be dealt with from a toxic exposure, from an infectious exposure. So there's so many things we need to look at to figure out. So going back to the initial question, is there a medication? What are the best medications for chronic fatigue or fatigue in general? There are no medications really that have been developed that can address fatigue. Some things can address particular components of fatigue, but there's no medications that can address fatigue. There's nothing that can replace a good functional practitioner, whether it's a doctor, a nurse, a nutritionist, a health coach who's been trained in the methodology, the fixing fatigue framework, to go through and leave no stones unturned, to find all the components of the imbalance that's causing this. In functional healthcare, we're all about imbalances. We're all about addressing imbalances. We don't want to wait until they become diseases. We want to address imbalances. And yeah, fatigue can be caused by a serious disease. And of course, we have to rule that out. Make sure there is no cancer, an autoimmune disease, or an internal bleeding situation. All those things have to be ruled out. Most fatigue is not caused by one of those things. Most fatigue is caused by chronic imbalances that I believe are a result of lifestyle, nutritional imbalances, stressors, dietary things that just make the system have to work harder and deplete the body of energy, and toxic exposures. So if you're looking for a drug solution to chronic fatigue, this is not where you're going to find it, because I don't believe it exists. And if somebody tells you it exists, then they probably don't have the full picture. In medicine, there's just a lot of chasing around for the right cure, which is usually pharmaceutical. When sitting right in front of our faces are the symptoms that lead us to understand why those symptoms are occurring and what we need to do. What we need to do to correct it, from a diet approach, from a nutritional imbalance approach, toxic exposure, stress, lack of sleep, movement, etc. So this helps to give you a framework for looking at fatigue, a framework for looking at what is going on in the deep underlying recesses of the body that are creating this imbalance that leads to low energy production. And in our fatigue fixing framework presentations that we've done, we'll put the links in the chat. And if you're interested, just put a message in the comments that says, I'm interested in your fatigue fixing framework. And we'll put some resources in there so that you can know. We have an upcoming event that is going to be phenomenal, 3 days, to just really unpack all the things that are related to fatigue. So thank you for being here. Subscribe to the channel, please. Comment below. Let us know if this was helpful and what more information you would like us to present to you. And until next time, shine on.